This is an instructional video on the exchange breathing method, a seizure rescue therapy. Have you ever wondered why they ask someone to hyperventilate whilst having an EEG to try and bring on a seizure? And have you ever thought that if hyperventilation brings on a seizure, that somehow getting breathing back to normal might stop a seizure, in the same way that breathing into a paper bag can stop someone from hyperventilating and bring their breathing back to normal? Well, the exchange breathing method works in a very similar way to this to stop a seizure. It is very easy to do. It is as simple as giving a puff of your out-breath into the nose of the person who is having a seizure. So you are breathing into their nose just like in CPR in first aid training. I used the exchange breathing method on my son many times between 2013 to 2017 when he was having hundreds of seizures per week. It stopped many seizures for my son. Luckily, my son is now seizure-free. So when can you use the exchange breathing method? Well, my son's seizures had a few different stages and he had two types of seizures. He had absent seizures and he had clonic seizures. With both types of seizures, his breathing would go erratic, fast and shallow and eventually stop. His lips would go blue to beige to grey, meaning that there was not enough oxygen in his body. When he was in the hospital, he was attached to something called an oxygen saturation monitor, and the reading on this for the percentage of oxygen in the blood would start to go down as his breathing started to go shallow and eventually stop just before a seizure. Sometimes he would fall over or vomit during a seizure. Sometimes he was stood up, sometimes sat, sometimes lying down. I used the method with all the different types of seizures he had and found it was successful at stopping them all. When I used the exchange breathing method, I noticed that his seizures would either just immediately stop as soon as I gave him a breath into his nose, or if a seizure didn't stop immediately, then it would often be milder and then subside quite quickly. His recovery would generally be better after using the exchange breathing method, and he would be able to communicate with me afterwards and often carry on as if he had not had a seizure. I am now going to talk you through how to use the exchange breathing method. First of all, it is worth saying that, in my experience, the sooner you administer the exchange breathing method on the person having the seizure, the easier and quicker it is to stop a seizure. Another point is that with the exchange breathing method, it is often given when the person has completely stopped breathing. However, if the person is breathing even a little bit, try to sense when they are breathing in and give the exchange breathing breath at this point. And if you give more than one breath, feel yourself breathing in rhythm with the person. So as they breathe in, you breathe out. The other important point is that if you are giving an exchange breathing breath, then you want it to be full of CO2, carbon dioxide. So as much as possible, try to stay calm. If you are panicked and are breathing quickly or taking shallow breaths, like you are hyperventilating, then you may not have enough CO2 in your out-breath, and the exchange breathing method might not work because of that. I know it is hard to stay calm while someone is having a seizure in front of you. When I first started to use this method, sometimes I would take a breath in and hold it in to build up the CO2 in my lungs, and then give it to the person. So if you're the sort of person who might panic when someone is having a seizure, then try to take in a breath of air and hold it for 2 to 3 seconds. So what do you do with this breath? Well, other than how easy it is to use the exchange breathing method, the other great news is that you can use it in any position. So with my son, sometimes he would be stood up when his seizure started, sometimes sat down, and sometimes he would be lying down or fall down to the floor. You can use the exchange breathing method in all of these positions. Now you're going to see my wonderful daughter Freya demonstrating how to do the exchange breathing method in different positions. First of all, here is our friend, whom we have called Stephanie, lying down on the floor, having a seizure. Freya is taking a normal breath into her lungs. If she feels panicked or that her breathing is fast or shallow, she might hold in her breath for a couple of seconds. While she is doing this, she is observing Stephanie, seeing if she is breathing or not. This time, Stephanie has completely stopped breathing. Her lips are turning blue. The next step is for Freya to form a seal with her mouth over Stephanie's nose. Freya is approaching Stephanie's face from the side and placing her mouth over Stephanie's nose. Freya is making a seal against her skin around her nose so that the air Freya is going to breathe out will go into Stephanie's lungs. Now Freya is giving a breath into Stephanie's nose. And now, if it has worked, Stephanie's seizure will either stop immediately or within a few seconds. So just take about 2 to 3 seconds to observe and see if the seizure appears to have stopped or be going away. If the exchange breathing method does not work the first time, Freya will take another breath in, and again, if she feels she is a bit panicked, she can hold it for a couple of seconds. Or if Freya feels fine and calm, she can just go ahead and again breathe her air out into Stephanie's nose. With my son, occasionally it might take me 3 exchange breathing method breaths if the seizure had not quite ended, but usually 1 breath did the trick. Stephanie is an adult, so she can take a normal breath. You will need to give a smaller amount of air for a child who has smaller lungs and a very small breath if you are breathing into a baby or a toddler. It is highly recommended that you attend a CPR course, which will give more information and training on this. If Freya had noticed that Stephanie was breathing a bit, even if it was shallow, she would give the exchange breathing breath when she noticed that Stephanie was breathing in. And if Freya gave Stephanie any further exchange breathing breaths, she would give these in rhythm with Stephanie's breathing. Some people have reported that after giving an exchange breathing breath in, they find they can't give it as the airway seems blocked. The theory is that the out breath from yourself only needs to reach the nasal cavity in order to have an effect and stop a seizure in the other person. The nasal cavity is just at the top inside of the nose, so if the air passage is blocked, this should not matter, although it would be helpful for the person to have some air in their lungs. However, some people have used the methods used in CPR training to position the head so that it is easier to get a breath in. If you have attended CPR training, you might like to try this. However, it can sometimes be difficult to position the head of someone who is having a seizure, and personally I did not find this to be necessary. So here is Stephanie having a seizure, or about to have one. Perhaps her lips are going blue. Freya is taking a normal breath into her lungs. If she feels panicked or that her breathing is fast or shallow, she might hold her breath in for a couple of seconds. While she is doing this, she is observing Stephanie, seeing if she is breathing or not. Stephanie has completely stopped breathing. The next step is for Freya to form a seal with her mouth over Stephanie's nose. She is approaching Stephanie's face from the side and placing her mouth over Stephanie's nose and making a seal against her skin around the nose, so that the air Freya is going to breathe out will go into Stephanie's lungs. Now, if it has worked, Stephanie's seizure will either stop immediately or within a few seconds. So just take about 2 to 3 seconds to observe and see if the seizure appears to have stopped or be going away. Once again, if the exchange breathing method does not work the first time, Freya will take another breath in, and again, if she feels that she is a bit panicked, she can hold it for a couple of seconds. Or if Freya feels fine and calm, she can just go ahead and breathe her air out into Stephanie's nose. Well, that's about it. Thank you for watching, and I hope you find the exchange breathing method works for you. Please feel free to join the Exchange Breathing Method group on Facebook, where you can ask any questions and share your experiences there. Thank you.